Have you ever stopped to ask yourself if you might be unknowingly damaging your heart because of one seemingly harmless habit? Each morning, you brush your teeth, brew your coffee, sit down, and start scrolling through the news on your phone. But behind that peaceful routine, one of the habits you're repeating could be the silent culprit slowly weakening your heart health. As a cardiac surgeon, I've seen hundreds of seniors walk into the emergency room in critical condition, not because they smoked, not because of an accident, but simply because they didn't realize they were repeating a harmful habit every day. That one habit was quietly draining the strength from their heart.
A heart attack doesn't always strike like a violent tsunami. Sometimes it starts with an irregular heartbeat, a mild fatigue you brush off, or a restless night of sleep. And then, on a day you least expect it, the risk of stroke comes crashing down, fast, hard, and without warning. Your loved ones won't understand what happened. You still ate well, took walks, had conversations. But those normal things, if done the wrong way, can become early warning signs of serious trouble. What haunts me the most is knowing that many of them could have lived 5, even 10 more years if they had just learned sooner what I'm about to share. In this video, I'll reveal 10 daily habits that are silently destroying the hearts of older adults, along with simple, at-home solutions you can start today. If you're over 60 or care for aging parents, this might be the most important video you'll ever watch. Don't look away. Every passing second is a chance to live longer. Imagine this. You're a father, a mother, someone who has overcome countless challenges in life. Now, in retirement, all you long for are peaceful mornings and the chance to live a healthy life surrounded by your children and grandchildren. But there's a harsh truth. Many seniors today live in an invisible fear, a fear that a sudden heart attack could take everything away. They don't talk about it. They don't want to trouble their kids. They don't want to admit they're getting weaker. But every time they feel lightheaded climbing the stairs or wake in the night with chest discomfort, that fear quietly grows. Older adults suffer not only physically, but emotionally. They wrestle with a gnawing loneliness and a haunting worry. What if I have a stroke while no one is home? They silently search the internet, typing phrases like early signs of a heart attack or stroke risk after 60, hoping to find some way to live a little longer. But the internet is overwhelming, full of conflicting advice, and doctors are often only available a few times a year. Many seniors say they feel invisible even in their own homes. Their children are busy with work, tired at night, and no one has time to ask, "Dad, how are you feeling today?" Some even hide chest pain or shortness of breath, afraid of being scolded for worrying too much or complaining again. That silence is dangerous. It's the reason so many heart attacks go unnoticed until it's too late. This fear is not just emotional, it takes a toll on the body. Every racing heartbeat caused by anxiety, every sleepless night spent overthinking puts strain on an aging heart. And over time, that hidden stress builds, and the risk of a heart attack becomes very real. What's worse, many accept it as just part of getting old, not knowing they can change the outcome, if only they're given the right knowledge and tools. Do you know why so many seniors stay silent even when they know their health is declining? It's not because they don't feel it. It's because they're afraid of being a burden. That silence can be more dangerous than the symptoms themselves. I once treated a patient, a 74-year-old man living with his wife and 2 adult children. He had trouble breathing while walking and often felt mild chest pain, but he never told anyone. When asked why, he simply smiled and said, "I don't want my kids to worry. They're too busy." 3 months later, he was rushed to the hospital with a massive heart attack, and he didn't make it. This is not a rare story. Every day, hundreds of families lose loved ones because no one noticed the early signs. For seniors, it's not just about physical health, it's about dignity. They want to feel like they still matter. They want to believe they still have control over their lives. But when the heart grows tired, when breathing becomes harder, and when sleep is no longer restful, what they need isn't more pills. They need someone to listen. They need trusted information. They need simple, practical solutions they can actually use. If you've read this far, remember this. A small gesture, like checking your parents' blood pressure in the morning, might be the one thing that prevents a tragedy. This video will walk you through specific steps you can take at home so you don't have to wait until it's too late. Mrs. Grace, a 68-year-old woman, was once a beloved English teacher at a local high school. After retiring, she lived with her husband in a small house on the outskirts of town. On the outside, she seemed healthy, shopping for groceries, cooking meals, tending the garden. But inside, she carried a quiet fear. Her heart often gave her a sharp pain, especially in the morning. She thought about going to the doctor, but reassured herself, "It's probably just age. I'll rest and it'll pass." One afternoon, while sweeping the yard, she suddenly collapsed, clutching her chest. Luckily, a neighbor saw her and called for an ambulance. At the hospital, doctors confirmed she had just suffered a mild heart attack. But had help come even a few minutes later, the outcome could have been far worse. Mrs. Grace didn't smoke. She wasn't overweight. She ate moderately and stayed active. So what almost cost her life? It was her daily habit of sitting still for over an hour after breakfast to read the newspaper or watch TV. No movement, no awareness of the recurring chest pressure that had been happening weekly. She had no idea that postmenopausal women face a significantly higher risk of heart attacks and that their symptoms are often more subtle than in men. Signs like chronic fatigue, insomnia, indigestion, or upper back pain can all be early red flags. After being treated and given a new lifestyle plan, Mrs. Grace began making small daily changes. A 15-minute walk after meals, monitoring her blood pressure, cutting back on sweets, and most importantly, she started sharing how she felt with her husband and children instead of staying silent. Within just 3 months, her tests showed stable blood pressure, a significant drop in cholesterol, and she felt more confident with each passing day. Mrs. Grace's story is a powerful wake-up call for millions of older adults. You don't have to wait until you collapse to take action. Listen to your body. Never ignore even the smallest signals, because sometimes a small change can save a life. One of the most common misconceptions among older adults is the belief that a heart attack always comes suddenly, violently, and unmistakably. Many think that if they're not experiencing severe chest pain or collapsing, their heart must be fine. But in reality, experts at Mayo Clinic and the American Heart Association, AHA, have repeatedly warned. More than 50% of heart attacks in people over 60 occur silently, with vague symptoms like fatigue, indigestion, insomnia, or something as subtle as a mild discomfort in the left shoulder. What's more concerning is that many seniors mistake heart-related pain for digestive issues, especially when they feel chest tightness accompanied by heartburn or bloating. These sensations are often dismissed as just something I ate, when in fact they could be early warnings of myocardial ischemia, a lack of oxygen to the heart muscle that, if untreated, can lead to a life-threatening heart attack. A study by Harvard Health found that over 40% of women hospitalized for myocardial infarction had none of the classic symptoms like chest pressure. Instead, they reported nausea, dizziness, and extreme fatigue. Many older adults also misunderstand the nature of chest pain itself. They believe that if the pain goes away quickly, it's nothing serious. But according to the AHA, brief, recurring chest pain may actually be a sign of stable angina, a warning that the arteries are narrowing and a serious heart attack could occur if not properly monitored. Even more, symptoms like anxiety, Sleeplessness or unexplained palpitations can mask the real signals of heart disease, making it harder to detect until it's too late. Another widespread misconception among seniors is the belief that you're only at high risk of a heart attack if you already have clear underlying conditions like diabetes or high blood pressure. But in reality, research from the Cleveland Clinic shows that over 30% of heart attacks occur in people with no prior medical history, triggered instead by chronic stress, poor sleep, and sedentary lifestyles. This false sense of security leads many to think, I eat healthy, I don't smoke, I'm probably fine, and they skip routine checkups, putting themselves at risk. Another dangerous myth is that heart attacks mostly affect men. However, data from the American Heart Association reveals that postmenopausal women actually face a higher mortality rate from heart attacks than men of the same age. Why? Because their symptoms are often subtle and misinterpreted. Instead of chest pain, women commonly experience insomnia, shortness of breath, digestive issues, or pain in the neck and upper back. This lack of awareness prevents many women from seeking care early, leading to devastating outcomes. Additionally, many people believe that taking medication alone is enough to protect their heart. But modern cardiology clearly shows medications are only part of the solution. What truly makes a difference is a comprehensive lifestyle approach, a low-salt, low-sugar diet, gentle exercise after meals, and managing both sleep and stress levels. A report from Harvard Health emphasizes, patients who follow medication plans plus adopt a heart-healthy lifestyle can reduce their risk of another heart attack by up to 60%. Unless these misconceptions are properly explained, many older adults will remain vulnerable, only realizing the danger when it's already too late. Even if you eat well, don't smoke, and get some light exercise each week, just a few seemingly harmless habits can quietly push your heart into danger. According to Mayo Clinic and Harvard Health, more than 60% of heart attacks in older adults are linked to everyday behaviors repeated over many years. So, what are the top 5 habits silently damaging your cardiovascular health? Sitting still after meals. This is the most common habit among people over 60. Finishing a meal and then sitting down to relax, watch TV, or nap without moving. It may feel like rest, but in reality, it slows down circulation, leads to blood pooling, and increases the risk of blood clots. Experts from the American Heart Association recommend walking lightly for 10 to 15 minutes after eating to support digestion and relieve pressure on the heart. Most people don't realize that this one small change can significantly reduce long-term risk of heart attacks and high blood pressure. Drinking too little water to avoid bathroom trips. Many seniors cut back on fluids because they fear waking up at night to urinate. However, dehydration causes the blood to become thicker, placing extra strain on the heart and increasing the risk of coronary blockages. When blood thickens, the heart must pump harder, leading to higher risk of heart attack, hypertension, and stroke. The solution? Spread out water intake during the day and include water-rich foods like soups, vegetables, and fresh fruits. A helpful tip, avoid drinking large amounts after 7 p.m. to reduce nighttime urination. Poor sleep or irregular sleep schedules. Low-quality sleep raises cortisol, the body's stress hormone, which elevates blood pressure and accelerates heart rate. According to Harvard Health, chronic sleep deprivation is a top risk factor for heart failure and arrhythmias in older adults. Your body needs 7 to 8 hours of deep sleep each night to restore both heart and brain. Aim to sleep by 10 p.m., limit exposure to phone screens, and keep your bedroom dark and quiet. As we age, the heart becomes more vulnerable. But not every solution requires medication or a hospital visit. There are simple, powerful things seniors can do at home starting today to help prevent heart attacks and protect their long-term cardiovascular health. Drink enough water consistently and correctly. Older adults often don't feel thirsty, leading to mild dehydration that thickens the blood, raising the risk of clots and heart attacks. Start each day with a glass of water. Spread water intake evenly throughout the day. Aim for 6 to 8 glasses. Avoid drinking large amounts after 9 p.m. to prevent nighttime urination. Gentle daily movement. There's no need for intense workouts. Just 15 to 30 minutes of walking, gentle stretching, or deep breathing in the morning or early evening can significantly improve circulation, lower blood pressure, and ease the workload on the heart. Balanced diet, low in salt, sugar, and fat. Replace fried foods with steamed or boiled dishes. Reduce salt gradually using natural seasonings like garlic, onion, and ginger. Add potassium-rich and high-fiber foods such as bananas, oats, salmon, lentils, and dark green vegetables. This supports blood pressure control and reduces cholesterol. Positive mindset. Reduce stress. Mental health directly affects the heart. Seniors should stay socially connected, talk with family, meditate for 5–10 minutes, or listen to calming music. Chronic stress increases inflammatory hormones, damages blood vessels, and silently contributes to heart disease. Protecting emotional well-being is just as crucial as managing physical health. Get regular cholesterol and blood sugar tests. Keep records and share them with your doctor. Never stop medications without consulting. Don't ignore unusual fatigue or discomfort, especially if there's a history of heart disease. These small, consistent steps act as a silent shield, protecting the hearts of older adults from sudden danger. And above all, let love be the driving force, encouraging your parents or even yourself to care for your heart every single day. As your parents grow older, the most valuable thing you can do isn't just taking them to the hospital when something goes wrong. It's helping them prevent heart problems before they happen, starting with the smallest everyday habits. Talk with your parents more often. Loneliness and emotional stress are silent threats to heart health, especially in the elderly, yet they're often overlooked. A short phone call, a simple check-in each evening can be the most powerful emotional medicine. Take the lead in reshaping the family's diet. Go grocery shopping with your parents. Choose heart-friendly foods like oats, salmon, leafy greens, and fresh fruits. Reduce foods high in salt and sugar. When the whole household eats healthier together, your parents will find it easier to stick to those habits. Check and record their health numbers regularly: blood pressure, cholesterol, blood sugar. Don't wait for a heart attack to act. Encourage gentle movement too, like a shared walk in the evening, simple breathing exercises, or even light playtime with grandparents. Sometimes inviting your parents for a short walk is enough to make a big difference. And most importantly, never underestimate their emotions. A quiet father, a forgetful mother, they may be carrying silent burdens. As their child, you are the first one who can notice, care, and walk with them through it. Your presence, empathy, and proactive care, these are the priceless gifts you can offer your parents. Give them now, before it's too late. If you followed along this far, you might be quietly asking yourself, is my heart or my loved one's heart truly okay? That question isn't easy to answer, because a heart attack doesn't knock loudly. It lurks silently, patiently, striking when you least expect it. Maybe your parents still seem active. They cook, shop, care for the grandkids. But what you don't see is that last night they couldn't sleep. This morning, they had to stop and catch their breath after just a few steps. The first heart attack is often a wake-up call, but sometimes it's also the last. Don't wait until the emergency room to whisper the words, "if only." Don't let something as simple as a glass of water or a check-in message become something you regret not doing. You can start today, with dinner shared at the same table, with a message that says, "Mom, how are you feeling today?" If this message touched you, share it with someone you love. Let it be a quiet but powerful reminder that protecting the heart is how we protect each other. Don't delay. Time is not something we own. Take action today for those you love, for yourself, for a heart that's still beating. Because love shouldn't wait, and prevention is the purest form of care. Do something small so something big never happens. Do it now.